Hey guys, hope you're having a great day. We're going to go through the endocrine system today, and this is our second to last system. So we're going to go over the endocrine today, and then we're going to hit the reproductive next time. So here we go. So the functions of the endocrine system, it's basically all of the hormones that get released into your system, and basically they're going to be sending, excuse me, the signals around. Basically, you have hormones that are slower, some that last longer, some of them go fast. It just depends on the different types of hormones that we're talking about. But the basic, like besides the hormones, it's going to regulate growth, development, maturation. It's part of your metabolism and other things like that. So, but basically, endocrine system is the glands that release your hormones. Here you can see a couple of or what we're going to talk about. And there's glands all over your body. We're going to hit like the main ones. So the first one is the pituitary gland. So the pituitary gland is the small pea-shaped gland that's hanging on the underside of the brain. It's actually referred to as the master gland because it basically controls a lot of the body's hormones. So it kind of is controlling a lot of your system. It does work with other glands and other brain structures to help regulate all of this. The one that it works most closely with is the hypothalamus. Excuse me. And so the hypothalamus is part of the brain. So this is what it looks like. It's right here. Like it says, it's the P-shaped. It has two parts to it. So there's an anterior and a posterior. You don't need to worry about that. So we're going to also go through some of the hormones, and I would know what these do. So growth hormone, or GH, basically it's telling your body when to grow, and that's why it's called the growth hormone. Makes sense, right? ACTH, which is adrenocorticotropic or corticotropic hormone. This actually is the hormone that controls how your body is regulating water, how it's regulating balance, glucose levels, blood pressure. Basically, it's kind of a controlling hormone. It is also produced in the pituitary gland, so these ones are all being produced in the pituitary gland. You have the TSH, which is thyroid stimulating hormone. This one is actually stimulating the thyroid to actually produce the hormones that it needs, and your thyroid is actually regulating your body's metabolism. Oxytocin, this is stored in the back part of the pituitary gland, so not the anterior, it's going to be in the posterior, and it actually stimulates uterine contraction. So when a woman goes into labor, this is the hormone that gets released that says, hey, you need to keep contracting. It also helps release milk from the milk ducts. So there's oxytocin. Then we have the thyroid gland. The thyroid gland, it's the one that sits right here. It's the one that I had a little like plasticky one to show you guys at the beginning of the semester. It's the bow tie one, and it sits right below your voice box, and it basically wraps around your trachea. So this is the second gland. The hormones that it releases, the first one is the thyroxine, and thyroxine, basically it's a metabolic hormone, so it's going to kind of control how fast your body is, or how your cells can convert food and energy, or food to energy. So that's kind of just figuring out how fast your body is going to be able to do that. Our next, it's not necessarily a gland, it's actually an organ, or more of an organ. It's bigger, it's probably one of the bigger glands, but this is the, it looks like a fish. It's right on my head right here. So it's located behind your stomach, and so it produces hormones, but again, your pancreas also produces digestive enzymes. So the pancreas is one of those special ones that actually gets put into multiple organ systems. But it's behind your stomach. It's a little flat fish-shaped one. Again, you can see it right here. It kind of wraps around some blood vessels here, and then it goes underneath your stomach. So one of the major things that your pancreas does is it releases insulin. You guys have probably heard of insulin. We're going to get into diabetes in a few slides. But this is released when your blood sugar goes high. So what it does is it actually helps lower your blood sugar. So the major effect of this is to decrease your blood sugar. So glucagon is actually opposite to insulin, and so this gets released when your blood sugar is low. So it gets released so you can have, so your liver doesn't have to go through a whole ton of work. Let's see here. The adrenal glands, this is another gland. So these sit on top of the kidneys. They're the little triangle shaped guys. You can see them right here. They kind of look like they're almost like little hats for the kidneys. They release cortisol. And cortisol, again, it's a metabolic hormone. So it's going to help metabolize carbohydrates, fats, proteins. Cortisol is actually known as the stress hormone. I would know that that's kind of the other name for cortisol is the stress hormone. But basically, if you are under a lot of stress, it is going to be constantly released, which is not a good thing, because if you're releasing a lot of cortisol, it actually suppresses your white blood cells. So you actually, that's why if you get super, super stressed, you're more likely to get sick. And that's because your white blood cells are not being able to do the job that they need to do. So there's cortisol. Adrenaline is also released in the adrenal glands, which kind of hopefully makes sense, adrenal glands, adrenaline. But this is released from just a middle section of the adrenal gland. Basically, your adrenal glands release 80% adrenaline. Oh, excuse me. But basically, this is your fight or flight hormone. So it's going to kind of help regulate, it's called the sympathetic response, and then you have the parasympathetic, but you don't need to stress too much about that. But basically, it's going to help regulate your stress during fight or flight. So you have noradrenaline. Again, this is helping with your fight or flight. This is about 20% of the secretions from the middle part of your adrenal gland. But this is, again, you have adrenaline and then noradrenaline. So those are your fight or flight hormones. So your sympathetic response. So this is when you get scared, or this is kind of when this gets activated. Your heart rate goes up, your breathing rate goes up, your blood flow actually increases to your muscles, because if you decide to flight, then it's going to help you get out of the situation quicker. Your blood pressure goes up because you have increased your blood flow. And usually you start breathing a lot heavier, and that's because you're trying to get more oxygen to your system. So that's the sympathetic response. This parasympathetic is kind of just opposite. Your heart rate's gonna just be normal. It's gonna decrease. You're gonna have a decreased breathing rate or a normal one. But this is if you activate that sympathetic, the fight or flight, that's what's gonna happen. Okay, we have a few diseases and disorders with this. So the first one we're gonna look at is type 1 diabetes. So we have two types of diabetes to talk about. I would know the differences between the two of them. So with diabetes type 1, you're gonna have, and this isn't on there, so I would probably write these off to the side or take a mental note of these. The symptoms, so it's excessive thirst, you have unexplained weight loss, extreme hunger, you have to go to the bathroom a lot more, you have, you're tired much of the time, you have dry skin, sudden vision changes, and all those different things. So with type 1, this is a lifelong disease. So if you have type 1, you're going to have it the rest of your life. But this happens because your pancreas does not produce enough insulin. And so these, you guys have seen people checking their blood sugar levels, and this person is going to have to basically give themselves a shot. Then you have type 2. This is just you have high levels of sugar in the blood. Most of the time, this is brought on by your diet. So if you can control your diet, you have a far less chance to get type 2 diabetes. It is the most common form of diabetes, though, but the treatment for type 2 is going to be basically exercise and have a healthy diet. There is a third type of diabetes, but this could only happen in women because it's called gestational diabetes. And what happens is it's when women get pregnant, their bodies go through a lot of changes, and if the body starts to change enough that they don't get enough insulin and glucose and things where they need to, then they can actually get this gestational diabetes. With this, as long as the mom takes care of her diet while she's pregnant, most of the time this goes away as soon as she gives birth. So they just have to kind of watch this. So they test their blood often to make sure that their levels are okay. You have gigantism. This is due to the hypersecretion. So you're secreting more of the growth hormone. This could be caused, they think, by a non-cancerous tumor, so a growth of the pituitary gland. But you can see here, this definitely would be a person with gigantism. You also have dwarfism. Sorry, my head's itching, guys. Dwarfism is due to the hyposecretion, so underproduction of the growth hormone. This can be either a medical condition or a result of brain injury or tumor, all sorts of different things. You have hypothyroidism. On this one, your thyroid is overproducing, or sorry, it's not producing enough thyroid. So depending on when this is, it could result in mental retardation, stunted growth, some other things. It says cretinism, myxedema, if I could talk today, guys. So there's just some different symptoms of that. Then you have hyperthyroidism. So hyper is when it's producing too much thyroid hormone. This is going to include weight loss. Your appetite goes up. You're more nervous. You're more restless. With hypothyroidism, they can actually replace the thyroid hormones or actually do surgery to remove your thyroid. If you remove your thyroid, then they're going to have to give you the hormones. We have some careers associated with the endocrine system. So the first one is a clinical trials research coordinator. These are the people who are actually coordinating and getting the volunteers to actually, actually conduct research. So you can actually volunteer for clinical trials. If they have a new drug for some type of ailment and you have that ailment, you can volunteer for that. You have a medical researcher. This is a medical scientist. They're basically doing the research. These guys right now are extremely busy with the coronavirus, trying to find a cure, if they can find a cure, or a vaccine or other things. So medical researchers, these guys are really important right now in where we're at. Health educator. I would be considered a health educator. So they are providing community programs. These people can actually go into communities, not just in the teacher setting. You have a CNA. A CNA is going to answer, they're a certified nursing assistant. They're going to answer any questions about patients, aid them, take them meals, make their beds, different things like that. You have an LPN. These are going to be caring for the bedside care, taking temperatures, vitals, different things like that. They can apply dressings, monitor catheters, all those things. And then the registered nurse is going to be treating the patients. These are the ones who are going to be helping the doctors a lot more. So if you have any questions, let me know. Hope you guys have a great day.